Well, one of the questions on our group this week, or it's actually come up a couple times, is about headaches during pregnancy. Kind of, are they common? What are some red flags? And what are things you can do to help alleviate that discomfort, especially when just Tylenol isn't working?
So I think, first of all, the first question is the headache new onset?
Mm-hmm.
And if it is happening before 20 weeks, then it is of less of a concern.
Mm-hmm.
And we're talking about primarily migraine headache, which is very common.
Mm-hmm.
It could be migraine headache that's episodic related to menstruation and whatnot. And it turns out that 2 out of 3 patients, migraine headache actually improve during pregnancy.
So,
And then for the remaining number of patients, it may be kind of stable. And about 5% of patients, it gets worse. But if you have a history of headache, then I think really taking something is very important. We start with Tylenol. If Tylenol doesn't work, but before talking about medication, you know this too. Many women are so afraid of taking anything.
mm-hmm.
But I feel that your body is a good filter system.
Mm-hmm.
So you can take something like Tylenol, but it won't really affect your little one, especially if you're taking here and there.
Right.
So you start with Tylenol, and if Tylenol doesn't work, then it is Tylenol with caffeine. And if that doesn't work, then Furosemide, which has a third agent. This is the first line of therapy for migraine headache.
Mm-hmm.
And then second line of therapy, if those regimens do not work, then we can try short course of NSAID like aspirin, ibuprofen, especially under 20 weeks.
Mm-hmm.
The key is speaking with your provider and say, hey, I have this new headache or I have history of headache.
Mm-hmm.
Can I take something? And if you are able to manage your headache with medication and is not lasting longer than a day, I think it is safe. The other reason that many people complain of headache is that people stop drinking coffee.
Yep.
All of a sudden.
Mm-hmm.
And if you were to have 200 milligrams of caffeine, which could be 2 cups of coffee, depending on whether it's homemade, Dunkin' Donuts, or Starbucks,
Right.
you don't need to stop drinking caffeine.
Mm-hmm.
And then other types of headache, like tension headache or cluster headache, usually are not affected by pregnancy. But the most common headache, it is migraine headache
Mm-hmm.
that people complain about. And on our post, often people bring up preeclampsia, which is really after 20 weeks.
Mm-hmm.
So first trimester or beginning of second trimester, we don't really worry about preeclampsia.
Right.
So I think history is important,
Mm-hmm.
and the onset and duration of a headache is important.
Another thing I think I see, and I know we've discussed this before, is the amount of stress that people have during pregnancy. Worry, stress can certainly, cause tension, I think, and headaches as well. So I remember when I first started with pregnancy and was getting some headaches, doing things like guided meditation, trying to make sure that I wasn't clenching my jaw, I was relaxing. Sometimes it's just a little drop in the bucket doing those things, and it might not make a difference, but examining stress and trying to control anxiety as much as possible, I think would probably be helpful in terms of headaches too.
In most cases, whether it's headache, nausea, vomiting, anything that lasts more than 24 hours, I think it's important to speak with your provider.
Yeah.
But, the main thing that many people have hard time doing is taking something.
Mm-hmm.
And headache, if you do not medicate in time, it's really hard to catch up.
Oh, yeah.
Yeah.